Okay, go ahead. Anytime you're ready.
All right. Well, first of all, I wanted to thank both Abigail and Michelle for this opportunity. I think it's very important for individuals to be exposed to as many opportunities and career options as possible. And I think the most important way that you can do that is to speak directly with someone who's in that particular field, so who can give you some direct insight into what it takes to become a pediatrician, as who I'll talk about today, but also just be able to brainstorm and ask questions about the particular path and questions. So again, thank you all for your commitment to helping the next generation, and thank you all for the opportunity for me to share. So I will, if you will thumbs up if you are able to see my PowerPoint. Okay, perfect. All right, so very informal. Please do ask questions. I don't know, Abigail, and I do have a question side at the end, but if you all have questions throughout that are burning, I will. If you, Abigail and Michelle, want to keep track of the chat, and if you want me to stop and ask some questions, I'd be more than happy to do so that I can attend to the questions as they come. So. All right, so who am I? I am Dr. Monica Moore. I am a board certified pediatrician. I'm currently residing in the Atlanta, Georgia area. I am the CEO of a virtual pediatric practice, Premier Wellness, but I don't stop there. I love doing other things and broadening my horizons. So I also have founded a nonprofit organization called Girls Growing Gracefully, in which I curate experiences that help to cultivate the mother-daughter bond. And so my goal is to help provide a safe space for moms and daughters to share with one another. And I also wrote a book called Be Unique, which is a girl's guide to self-awareness and self-acceptance. So for me, my journey to becoming a pediatrician has led me in a lot of different other opportunities, and I'm very grateful for every one of them. All right, so you all might already have the answer to this, but if you are still contemplating your career goals and want to know a little bit more about what a pediatrician is, pediatrician is someone who addresses the mental, the physical, and the emotional needs of children. And I always say that I take care of kids from the cradle to college. So we care for kids all the way from birth all the way up until adolescence. You will find some pediatricians that will even see children up until the age of 21. And so it is really important as a pediatrician that we recognize the importance of treating the whole family, because we want to come alongside those family and that child in the developmental stages. So helping the family answer questions, supporting for them, advocating for them, and helping to be that medical home for them. Also, as pediatricians, we act as the liaison between the physician, our position as their pediatrician, as well as through advocacy for special needs that they may have. If they need to go to a specialist, we'll be the collaborator for that to continue to keep them informed. You may also wonder, well, what type of characteristics or personality traits does an individual need to possess to become a pediatrician? And like what I think just in a physician, in medicine as in general, just being really compassionate. I think really having a caring mind, a caring soul, and wanting to give back and help the greater need of others, but also being very patient, because they can oftentimes not always want to participate in the examination. So being very patient and aware, and just having a really unique niche in which you can care for the child, but also recognizing the need that you need to be an effective communicator. And I think that it's really important that you listen. And I think as a physician, that's one of the most important things that we do. We learn that in medical school about taking the medical history. So the examination is extremely important, but the history is so vital to finding out what that diagnosis is. And so being able to effectively listen and communicate with your patients is an extremely important characteristic and skill set that one needs to have in order to be a physician that is thriving and able to give back and able to be able to have that good relationship with their child and parent. So, what does it take to become a pediatrician? The journey is long, I will say, but it is well worth it. I would say that I wouldn't change it for the world. read a recent survey in the 2020 edition of the American Academy of Pediatrics put out that 95% of residents in their post-residency survey stated they still would choose pediatrics as their career. So I think it is one of those careers that you find yourself in, and you really do find it rewarding and fulfilling. But any of you that might be taking notes, because this is all just pictures, I don't have a lot of content verbiage. I'm just wanting to kind of speak to you all. But the first step is getting a bachelor's. So I'm not sure what the audience is like today, if it's mostly some high school students, some college students, but the first thing is to get your bachelor's degree. And I think it's really important that you recognize you don't have to be a science major. I have a really, really good friend who is a music enthusiast, and he is an accomplished pianist, and his major was music. He knew that he'd be doing medicine the rest of his life, so he majored in music. And so today he's both a pediatrician and a musician. And so as long as you're taking the right courses, and of course getting a counselor there at the medical schools at the undergrad level to kind of really help steer you in the right direction to find out what courses you need to take. And as long as you do really well in your prerequisite courses, there's a website called the AAMC that you may want to go to in order to find out the specific prerequisites that you need for the specific college the medical school that you want to attend, so that you're making sure that you take the right ones. But for instance, like biology, chemistry, English, those are some of the prerequisites that, of course, that you'll need to take in order to be able to gain admission into a competitive medical school. So after you have finished your bachelor's, then now it's time to apply for medical school. And as you all probably know, there's a lot of tests that you will have to take and on the journey to becoming a physician, whichever you choose. And so it's a test called the MCAT, which is the Medical College Admissions Test. And so that test is the admissions test that you will need to take around your senior year of high college in order to gain admission into medical school. And so, like most tests, you don't have to pass the first time in order to continue on your journey. They will allow you 3 chances in 1 year. They will allow you 4 chances in a 2-year consecutive period. But the overall maximum amount of times that you can take the MCAT is 7 times. So you definitely want to make sure that you are mindful and aware of what the limitations are as far as testing is concerned. The test is a long test, like you probably imagine. It's 230 questions, and it's an all day long 7.5 hour test. And the highest score that one can achieve is a 528. The lowest is a 472. And on average, those that have gained admission into medical school, their average score was about 512. So that is the goal that you want to have in mind. And so there are plenty of prep tests that you can take in order to adequately prepare for the MCAT, so that you can increase, of course, your likelihood of getting into a very competitive school. And we all know that test scores and GPAs and extracurricular activities and volunteer work is not everything that is needed in order to gain yourself a high likelihood of getting admitted. They're very important, don't take me wrong, but they really want to see that you are a very well-rounded individual. They want to see about your life experiences. So as you are doing your application, you really want to just be honest, talk about why you've chosen this career path and what some of your short and long-term goals as it relates to being a physician are. And so really being vulnerable and really being transparent, along with, of course, having the scores is really important as it relates to admission. And so there are 15 core competencies that they look for when you're doing the admissions. I won't go into all of them, but just to kind of give you a little idea of what some of the things are. Service orientation, social skills, cultural competency, teamwork. They look at how reliable and dependable one is, your resilience, and your adaptability. So those are some of the things that you want to be aware of when it comes to the applying. And you're going to apply to something called the AMCAS, AMCAS, when you are applying for medical school. So those are the things that you want to look at. And then going back to the MCAT, again, that's the medical college admissions test. They're looking at 4 critical areas that you want to be able to show a competency for. And so that's the biological and the biochemical foundations. And you'll, of course, learn all of that, in undergrad, because, of course, you're taking your core sciences, your biology, your chemistry, your organic chemistry. And they also want to know your chemical and physical foundations as well. Those are the systems that they also want to make sure that you are fundamentally have a fund of knowledge in. And then the psychological, social, biological foundations of behavior. So behavior is really important. So any of you all that are in high school or in college or taking any psychology classes, I really encourage you to absorb as much information as you can, because of course you are dealing with humans. And so really knowing how to effectively communicate with and understand the psychological aspect that individuals are dealing with is important. And then the fourth key component to the MCAT, again, that's the admissions test for medical school, is the critical analysis and reasoning skills. So those are the things that are important as it relates to taking the admissions test to get into medical school. And again, when you're applying the 15 core competencies. And the next step, after you gain entrance into medical school, is 4 years. So of course, we know that undergraduate education is 4 years, and then medical school is 4 years, is the average time. And some individuals may be on a longer track. Some medical schools specifically will have maybe a 5-year track for those individuals who may need to remediate some courses, or may want to do a slower track and not take all of the classes at once. There are some adjustments that can be made, but on average, it takes 4 years to successfully complete medical school. So the first 2 years, you're in the classroom. So you're kind of in there, kind of like undergrad, getting all of the lectures. You're taking your anatomy, your physiology, your biochemistry, your pathophysiology, and your behavioral science and your pharmacology. So you're kind of learning all of the textbook information in those first 2 years, and you're literally in the classroom. Majority of the time, you may have like a social science class or a class that you might be in the community, but mostly you're in the classroom. Then the third and fourth year is when it gets really, really fun, when you start to do your rotations. And so you get to go to the hospital and actually round with the attending physician and kind of learn the ins and outs of what the physician does at that point in time. Of course, it's not specific to what you eventually want to do, because that's what residency is all about. But in medical school, you get exposure to all areas. So psychiatry, OBGYNs, orthopedics, pediatricians, internal medicine, family medicine. So you have an opportunity in medical school in the third and fourth years to really get exposed, so that you will eventually know that when you apply to residency, which residency program really fits you and really fits your lifestyle. So after residency, the next step is to start taking more tests. And that is what we call the USMLE. And that is a 3-part testing that you have to take. So you'll take your first part of your USMLE in that second year of college. Then you'll take medical school part 2, you'll take about the end of fourth year. And then you don't take the last part until you get into residency, actually. So again, that's a 3-part test called the USMLE, and it's taken at the end of second year, the end of fourth year, and then in the residency. And then it's time to apply for residency. So once you decide, after you've done all of your medical school rotations, you kind of sit down and say, I really felt like I could do that. That could be a part of my life. I could do that every day. I could fit that into my grand scheme of what I want to do with myself. And so that's when you apply to residency programs. And that's when it's specific to whatever area of medicine that you want to practice. So for me, I applied to pediatric residency. And for me, I wanted to practice in a pediatric residency program that was at a pediatric hospital. That was just something that was really important to me, because that was the bread and butter. That was all they saw. The pediatricians that were there were pediatric trained. If you go to residencies where there may be family medicine there, and they may not see a lot of pediatrics, like I wanted that really good foundation. And so I chose to attend. Well, I got accepted. I was lucky to get accepted into my first choice down in Orlando, Florida. And so I did my residency at a place called Arnold Palmer Hospital for women and children. I think now it's called Winnie Palmer, but that was my next step, was residency. And so for pediatrics, it is a 3-year commitment. So 3 years in residency. And then after residency, you take your license, your board, you start taking boards to become board certified, and then you start looking for a job. So that's kind of long and short. I don't know if we want to stop now and ask any questions, because I think that was a mouthful about the journey. I'd be more than happy if anybody has questions now about that. If not, I can go forward. Michelle and Abigail, are there any questions in the chat that you'd like me to field?
No one has any questions. Oh, we just got one. Someone said, is there a lot of math used in medical school?
It's heavy math and heavy science, that you can imagine. So yes, definitely a lot of math and a lot of science in medical school. More so, I mean, I think that science more than anything, of course, but math is definitely important, because you're going to be calculating the dosages and everything for your little pediatric patients. So that's one of the important things to be able to do. And you, of course, don't want to make mistakes with that. So I would say it's probably more heavily science, but math is definitely a key component.
Great, that was the only question.
Okay, all right. All right, so I talked about the journey to becoming a pediatrician, but just more specifically, and to be a little bit more transparent and more personal about why I decided to become a pediatrician, probably starts more with why I decided to become a physician in general. Growing up, my grandmother was very, very ill. She had diabetes and she ended up dying of throat cancer. And so I saw her in and out of the hospital. Just pretty much that's majority of what I remember about my grandmother, always being sick, always being in the hospital. And I just always wanted to help people like her. And one of the goals in life I had was to heal people. And so that is what we do as physicians. We are healers. And so when I was in my 10th grade anatomy class is when I decided, I really do love the human body. I love how it functions. I love how it works. I love learning about it. And so that's when I decided to actually become a physician. And then I thought pediatrics would probably be my route, but I really didn't know for sure. So I started volunteering in the hospital. And I really do encourage you all not only to sit in on lectures like this and talk to physicians in the area of interest that you have, but also getting hands-on experience. And I was very fortunate to meet a physician, a pediatrician in my hometown, which is Pensacola, Florida. And he allowed me to shadow him one summer. And I was just able to really see the ins and outs, the day-to-day operations of what a pediatrician does. And so that was what I felt like I would do. But again, like I talked with the journey about becoming a pediatrician, you don't really figure that out until medical school is when you get exposed to the different areas of interest. And so I remember being on my family medicine rotation, and one of the doctors was like, oh, you probably should really, really think about family medicine. I know that you really love the kids and you want to do something with children, but you can kind of focus on the kids. And I'm like, well, I guess, but I really think that I know that I want to I just want to see kids. So I don't want to have a practice where I'm not able to devote my 100% of my time and my interest and my education and learning. If I'm seeing adults as well, I want to really be able to just focus on children. And so for me, that was how my journey began and how I decided to become a pediatrician. And I would not change it for the world. A lot has changed in medicine, but my love for helping others and being able to just really be connected with my families and engaging with my families has been something that has been extremely important and uplifting for me, and it's something that gives me great joy. All right, so now we know what the road to becoming a pediatrician looks like, the journey to get there. You know a little bit about me and why I made the decision to become a pediatrician, but what does it look like? Like, what do we do? Like, what does our day look like? And I do have a slide that speaks a little bit more about the different positions that a person can have as a physician, but most pediatricians, you wake up and have to be to the office between 8 or 9. So I've worked in various offices, and so some of them are 8 a.m. Arrival for the first patients. Others are 9 a.m. If you happen to decide to do something called a hospitalist, which means you just take care of kids in the hospital, then your hours of work are probably a 12-hour shift. So you're going to have to prepare yourself to be in the hospital for that shift. But they usually do like 412s or 410. So you really, you want to make sure, and they allow for you to have time to rest, because you want to make sure that you are at your mental sharpest when you are taking care of children, but specifically if you're in the hospital setting, because these are the really, really sick, critically ill children. And so we don't want to make any mistakes with that. So for me, as a general pediatrician, I'm in the office by 9, start seeing my patients. And of course, with COVID, a lot of practices have done different things in order to keep their patients safe. So maybe just seeing well in the morning and sick in the afternoon is a way that they can prevent the likelihood that a sick person would be in the same vicinity as a well patient. So usually you'll see, so you have newborns that will come in that have been discharged from the hospital. Usually we'll see them within 2 to 3 days of being discharged. It really depends on what's going on. So say the baby was having what we call jaundice, which is the yellowing of the skin. And it's, when we do the blood test, it's called a bilirubin. So say we've taken their bilirubin and it was kind of borderline, and we need the pediatrician to follow up and see what that level is. Because that might require the baby to have to go under something called phototherapy lights. So that baby would need to be seen sooner than later. Baby that might have been losing some weight in the hospital and was kind of borderline weight loss, we want to see them earlier. Or if this might be a first-time mom, it might be a first-time family, and so really wanting to support that family and answer any questions that they may have sooner than later. So getting those babies in on a quicker, sooner than later time frame would be the most important thing for them. And of course, we also see, like I said, adolescents. So kids are coming in for their sports physicals. They want to get cleared to play basketball, swim, soccer, tennis. So we do quite a lot of sports physicals in the office right now because of COVID. Now, a lot of you, I'm sure you all aware that there may be, looks like it's going to be an authorization of the younger kids getting vaccinated. So we do a lot of vaccinations. So a lot of offices are vaccinating against COVID. And of course, you just have your normal routine vaccinations that actually start at the age of 2 months. So when we come in that first visit, we go ahead and tell the families what they can anticipate for the visits coming up. And so that is your routine well visits to make sure the baby is growing well, checking in with the parents, make sure that they don't have any needs. And then also, of course, we see our sick patients, ear infection, sore throat, flu, tummy aches. Those are some of the things that we'll see. And I will say that most recently, with the pandemic and with so many individuals dealing with a lot of mental health issues and having anxiety, depression, worries, and fears as it relates to the pandemic, we're doing a lot of referrals for depression and anxiety. Some physicians will see and treat patients for that. Others will refer out. So those are some of the things that I will say as a pediatrician more recently have been increased numbers of diagnoses of depression and anxiety, dealing with the uncertainties and having so many fears. So that's the day in the life of a pediatrician. I don't know if any questions came up as I talked about what the day looks like.
No questions.
All righty. Y'all are easy crowd. So what do I love about being a pediatrician? So clearly you can tell that I love what I do. I always tell people when my patients, when I'm talking to them, that this should be something that you could do for no money. Of course, we want to get paid for what we do, but you literally love it so much that it doesn't even feel like work. Like it really just feels like you are giving back to the community. You are giving back to people that need you. You are forming relationships. You are helping families and supporting families in a very vulnerable time, because especially, like I said, with new parents, they're new to this. I mean, I love seeing when they first come in and they have like written down everything that the baby's done from like the time they woke up to the time they fell asleep. They have pictures of poop. They have pictures of rash. I mean, they have all of that. And then by the time they have their second or their third, they feel like a pro but just seeing the progression, I think that's one of the things that I love about being a pediatrician is I don't just take care of the patient. I also take care of the family and love to see how the families grow. But little kids are so resilient. I mean, they come in sick oftentimes, but they really do have the ability to bounce back, and they are so, fun and loving. Of course, some people think that's all we do, is just play with kids all day, but it's a lot more than that. But I would say that that is probably the most, fulfilling and rewarding a part about it. And so I love getting the little cards that they make. I love getting, them drawing their pictures, or at Christmas, very Christmas time, holidays, just getting little special gifts that are made specifically for me from my little patients is important, is special. But also seeing them go through their developmental stages from infancy to toddler to school age to when they go off and they leave me. I'm very sad, but I'm very grateful that they have matured and that they are, motivated to take that next step in life to pursue their dreams and their goals. And so that's an important part of the journey that I really enjoy seeing, and it gives me fulfillment. All right, so there's always challenges for any profession. I will say that there are some that have more than the challenges of being a pediatrician, but I would say, you see this lady here is at the computer, because we've changed to electronic medical records. So I would say probably this the thing that was a hard transition for me, was going from just paper charting, which is quick, simple, and easy. You may not be able to read everybody's writing, so that's a part of why the electronic medical record and just keeping all things together is really important. But I will say that's probably one of the biggest things that has been an impedance just to your day. It just makes the day a little bit longer. But again, I recognize the importance of it, but I do like my paper charts too. All right, so I told you that I would talk to you a little bit about what are some other jobs that you could function in. So again, so for me, I'm a general pediatrician, so I see kids in the office and my virtual practice as well, but I see kids from infancy to adolescence. But you could also be a specialist. So you could be a pediatric cardiologist, so kids that have heart-related issues. You could be a pediatric endocrinologist, which are you take care of kids with diabetes. You take care of kids that may be having overweight. They're overweight, and so the nutritionist is working with them, or they have thyroid disease. So that's what an endocrinologist would do. Or you may be a pediatric orthopedist. So you take care of bones and fractures, things of that nature. There's also a pediatric pulmonologist. So for those children that may have asthma, that may have a condition called cystic fibrosis, that's what a pulmonologist would take care of. And then there's also a pediatric gastroenterologist. So a person that deals with gastrointestinal issues such as reflux, kids with maybe chronic diarrhea. That's what a pediatric gastroenterologist would do. And then there's also pediatric psychiatrist. So, but that was a different track. So they have to do like a lot. They have to do their psychiatric residency, but there are those that just see children, most like adolescents. Psychiatry is probably more common than anything else. So then there's also physicians that choose not to practice in an office setting. You might have remembered me saying a hospitalist. So those are pediatricians that just see kids in the hospital. So the really sick kids, so they're on a ventilator, or they are, needing hydration. They are having like maybe multiple seizures, different things that you can't, of course, take care of in the office setting, will be the hospitalist. And then there's also physicians called a neonatologist. So neonate is a baby that's, up to 28 days, but they take care of those little tiny babies in the NICU, which is the neonatal intensive care unit. So that is a neonatologist who would take care of those children. And so they also work shift work as well, but those children, like I said, are really sick. Then there's some physicians that choose to do research. So I'm not sure if any of you all have an interest in working in a research arena, maybe pharmaceuticals, looking at the different new drugs that are out there. So some physicians may go the research route. And then there are also physicians that choose to get what we call an MD, MPH. So they have their medical degree, but they also go back to school and get their Masters of Public Health. So those are those individuals really want to work for public policy and advocacy. So that's another arena that a physician can work in. I've actually known a few people that have gotten their MD/JD. So they are both a medical doctor as well as they are a lawyer or a judge. And the other one is academia. So you probably watch like Grey's Anatomy, watch those residency programs, and you'll see the attending physician. So you have some physicians who really just they want to teach the next generation. So they are working in the hospital setting, teaching the residents, or they may work at medical schools teaching the medical school students. So those are just some of the different areas in which a pediatrician can work. And I think it's a very, very, very wide variety of areas. So you don't have to hold yourself to just one. Some physicians start in one arena and then they choose another one, depending on what their life is like. They may want to scale back or they may want to add a few things. But again, it is a very fun, fulfilling, rewarding position for me. And again, like I said, one in which I don't take for granted. I love the fact that parents, that one of my biggest things is I want to be able to educate, empower, and encourage my families. And so being able to also get trust from them and be able to build confidence in both my families as well as in the kids that I treat is something that is truly important for me to provide. And that is all that I have. I am open to any questions that any of you may have about pediatrics in general, medicine in general, just anything that you might want to filter my way.
I have a question. So
Okay.
how many patients do you see a day?
That's a very good question. And it really depends on the day and it depends on the practice and how many providers are there working. And so most physicians, so again, it varies. I've had some offices that I work in that there's 10 or 15 patients, and I've had some offices that I've worked in that there's 20 to 25 patients. I will say that most physicians would like to be able to spend 30 minutes to an hour with every one of their patients, but sometimes that's just not feasible, specifically depending on the demand that there is. You know, that most offices closed or had decreased hours during the pandemic. And so they're trying to, of course, accommodate their patient population. So that would increase the numbers when we are in flu and now COVID season. We're in the winter months when more illnesses arise, then you're going to have more patients because there's more illness. Back to school is always a huge demand for vaccinations, sports physicals, entrance like hearing and dental, so hearing and vision. So it can vary. So there's lows and then there's the highs. So I would say that the number varies depending on the season, time of year, and just the practice model.
And regarding the pandemic, how has COVID affected how you practice medicine? And do you deal with people who are, I guess, like vaccine hesitant? And how do you like confront people who are like that?
Yes. So I believe that the pandemic has changed the lives of every human, and it definitely has affected pediatrics, medicine in various ways. And so one of the most important things that we want to do as it was time to reopen up the office is to make sure that our patients were safe, that nursing staff, our administrative staff was safe, and that we as the physicians were safe. And so it's very important that we do questionnaires prior to the arrival of the patient to make sure that they themselves don't have a known exposure to COVID, may not specifically be waiting on a COVID test, or that if they have symptoms, there's, of course, there's protocol that the offices are going to take in order to safely bring the patient into the office so that they can get the needed care. That's also where telemedicine plays a huge role. So the families and patient can be seen comfortably and safely in their own home. Of course, if there ever arises any concern that they are not safe, that their illness is something that needs to be seen in the office setting, urgent care setting, or hospital, we can attend to that in a telemedicine visit and be able to adequately direct the family to where the level of care needs to be. To answer your question about vaccine hesitancy, it didn't just start with the pandemic. Vaccine hesitancy has been around for quite some time. And so we have a similar conversation with our families because every vaccine that has come out had to begin. It had to be a beginning. And it's one of those things where the newness of it was something that I recognized, but there's been other vaccinations that it's been the first time that we've rolled out a vaccine. So I think listening to the family, validating whatever their fears or their concerns are, but then providing them with accurate, timely, up-to-date, evidence-based information about the vaccine is the best way that we can help them to make a informed decision.
Okay, thank you, by the way.
You're welcome.
Also, another question. So, what would you say are the greatest challenges you faced in completing medical school and then residency? And then now, I guess, practicing medicine.
That's a really good question. That is a really good question. So, medical school was probably the hardest part. Residency had its challenges, but it was a steep learning curve. It really was. I mean, I have always been an A student, but getting those A's was a lot harder when it got to medical school. And I would say that I met a lot of friends here, but it was one of those things where I had to form those relationships. And so for me, what helped was those study groups. And I have the utmost appreciation for the late night study groups, going to, allowing the physician, the doctors allowing us to come in and look back at the at the anatomy information that we needed to look at. So having a really good support system. I attended Morehouse School of Medicine here in the Atlanta, Georgia area, and it was a very small class size. And so we got to really know our professors on a very personal level, and the support there was tremendous. And I don't believe that I would have successfully completed it if it wasn't for the strong support of my fellow medical students as well as the physicians that were there helping us as well. So that was a challenge probably for medical school. For residency, the challenge probably would have just been because it's so much more hands-on. And so seeing the sickest of the sick patients, I think that was one of the challenges there. I vividly remember a lot of my hematology, oncology resident rotations, as well as my ICU rotations. So it was hard. Death and dying is not an easy thing. So I think having the connection with the family, but then having to have that difficult conversation with those families was probably one of the more challenging things as it related to residency. And I think now as an adult-ish, I guess, right? Working in the field of medicine and just trying to, I don't use the word balance, like work and life, because I think it's very challenging to do that, because I think that something kind of always tilts on the other side when we talk about balancing. But my goal right now is to prioritize. And so I have a family. So trying to make sure that I prioritize the time that I spend with my family, but not taking anything away from the quality care that I provide for my patients is something that I strive really hard to be able to do.
I had a quick question. Oh, sorry. From earlier. So back to the math thing for medical school, what math course do you think is most used in medicine in general? Like for example, like algebra or maybe like calculus in your, yeah.
Yeah, I would say both algebra and calculus are probably the ones that do it kind of need to know. What and where, and remind me, Michelle, what level are you in right now?
I am a high school senior right now.
Okay.
Yeah, so I'm going to college next year, so very excited.
Okay, awesome. So
Yeah.
yeah, so what math are you currently taking?
Oh, I finished AP Calculus,
Okay.
and I am also doing AT Statistics currently.
Okay, so statistics would probably come into more like when it's testing. So I would probably say the math and the science, the math that I'm talking about is probably more for testing. I would say on a daily basis is probably not as critical, but definitely for testing. So statistics is something that we see a lot in when we talk predictive value, things of that nature, specificity and sensitivity in your in some of your courses and some of your classes, but not probably in my day-to-day work, but definitely to take the test, I think is important, like your MCAT and all.
Thank you.
You're welcome. I think someone else was talking when you were asking a question.
Oh yes, I had a question, just about like, oh, I just wanted to introduce myself. I'm Michelle also. I'm a
Oh,
second year gap year student. Yeah.
oh, second year, what
And
now?
then second year gap year. This
Okay.
is my second gap year. Yeah.
Okay.
So, I just wanted to know like how like, oh my God, my watch. How like a day in a life, like example of like a patient that was like difficult to treat or something like that, like anything like.
Okay. Let me come up with something. So probably, I guess some diagnostic dilemmas might be the harder ones to kind of, you don't have the answer right then and there. So you basically have to look at the patient. So say you have a patient coming in with fever. So there's something called fever of unknown origin. So I have a patient that's coming in with fever without a source, right? So their ears are normal. They don't have strep throat. They don't have pneumonia. This is all the things that I can check in the office. So then I have to think, where could this fever be coming from? So then I have to, we call it a differential diagnosis. And what that is basically, what are all the options, or what are all the possibilities of a diagnosis that this child could present with? So we think about the timing of it. We think about what other things may be going on. So really trying to be a detective. I tell parents, I'm going to ask you a lot of questions. Like I really am, because I have to get down to the bottom of what's going on with your child. And so I think that's probably one of the more challenging things, is when it's not cut and dry. It's not an ear infection. It's not strep throat. It's not the flu. I don't hear crackles on the exam, so I can't tell you for sure that it's pneumonia. Those are probably one of the more challenging scenarios. And I think the second question you asked, now I apologize, I forgot what it was. What was the other scenario you asked?
Or yeah, I think that was good. Like how like you went about like diagnosing a patient, like and it was really difficult to do so. But
Yeah.
thank you, doctor.
Oh, you're welcome. You're welcome. And the other thing I think to that question is, oftentimes patients will come in what we call somatic the complaints. So they got a headache, they have abdominal pain, they're not sleeping. And so you're trying to figure out what medical, physical diagnosis this could be. But oftentimes it's emotional and psychosocial. And so digging deep to find out, well, are you having some depression? Are you having some anxiety? Like, what else is going on? That's why I think it's so helpful to really develop a relationship and a rapport with your patient, because they'll more readily open up and have that conversation with you. And so that you're better able to diagnose and to support and to refer when needed. And so oftentimes, like I said, that is how they may present. And so you think it's a migraine, or you think it's a sinus infection, or you think it's, with the stomach pain, like, oh, is it appendicitis? Or, of course, there's other things that we look for specifically for that. But no, it really could be that they are depressed or that they're anxious. And so I think it's we as physicians is to do our due diligence to really hone in on what some other possible diagnosis could be, and try to really sit down. And that's one thing I will say, again, you all I'm sure you're at different stages. I think you're in your gap year, Michelle. The other Michelle, you are in high school. Sit down in the room. I don't know if you've ever been in an office setting and the doctor comes in, whips out, like they're in and out. They don't sit down. They don't really listen. And some people have unfortunately had that experience. But that's one of the main things that I was taught and that I do on a daily basis with my patients is I come in, I sit down, I have a conversation with you. I want to know about your day. I want to know how things are going. Before we even get into why you're here, I want to know about you. I want to know what's going on. And I think when they have a really astute physician, they're able to pick up on something's not quite right. They're not as jovial. They're not smiling. Their clothes may just be disheveled, or the parent may be dealing with some things. Specifically, postpartum depression is something that we are tuned to and astute for picking up on. And so that mom that's, maybe not making eye contact with me, or that mom that gives me a short answer, or that mom that's just seems down. And so it's really important for me to be able to tease that out, because again, I'm not just treating their child, I am treating the whole family. And that's the role that I play.
There are also some questions in the chat if you can look at that.
Did you want me to look at them? I don't know if I have access to the chat.
Let me see. Okay. Someone said, are there different durations of residency program for different specialties? Like, is the residency year different for dermatology? Sorry.
Yes, there are. So what you'll normally do, you'll do a preliminary year, like in internal medicine, and then you'll go on to do the residency in the other specialty that you want to go in. So the shortest residency is going to be 3 years, but like, for instance, OBGYN is 4, surgery, I believe, is 5. So it varies based on what your specialty is. So yes, and so again, there are many, like surgery, I believe dermatology, where what would they call their preliminary year is in something like internal medicine.
Someone said, how did you maintain a work-life balance during medical school? And would you happen to have any advice for pre-med students?
For pre-med students, so undergrad, you mean, or is this an undergrad student?
Yeah, I'm assuming.
Okay, so I guess for work-life balance in medical school, I didn't have a family. So my hat's off to my fellow classmates that did. We had several classmates that did have a family, so I would not be able to tell you how they did it, except for they had support. For me, it was just me at that point. I wasn't married, I didn't have my daughter, so I was able to just literally focus on medical school. But those colleagues of mine that did, they had family either here or back in their hometown that was just their biggest cheerleader, their biggest supporter, and they took care of their children while they were in school. And so it appeared that it was challenging for them, but they made it work. And I think that's when having a village around you becomes even more important, because it is a lot of late nights, it is a lot of early mornings, it is a very challenging and rigorous curriculum. And so having that support system that is taking care of your family, but also having the support system, like I said, we were very close in medical school as far as helping each other out, going over notes with each other. So I think that was the thing that really allowed me to be able to successfully complete medical school, was having the support that I did have, and those that had a family, it would be the same.
Ashita asked, did you ever have any doubts about becoming a pediatrician throughout med school or residency, and how did you overcome them?
Very, very, very good question. And I think that's one of the things that, again, having support around you and going back to the why, really going back to answer your question in short, yes, I definitely did. As I stated before, medical school was one of the most challenging aspects of my life. And so there were days that I said, was I cut out for this? Am I really able to do this? Am I supposed to do this? And so I had to go back to, why did I make the decision to do this? Is this something, I didn't go into it haphazardly. It was something that I really knew that it was my passion, it was my drive, it was my purpose. And so I thought about the lives that I would be able to heal, I thought about the lives that I would be able to touch. And so that is what really allowed me to have the resilience and be able to continue the journey that I began.
I don't think anyone else has any more questions. So thank you so much again for coming. I loved your presentation and all the insight you talked to us about. And a lot of people in the chat are saying thank you. I'm not sure if you can see that.
I can't, but I appreciate all of that. And I again appreciate the two of you, having the foresight to recognize that this was a needed platform and going forth and doing it and reaching out. And so I again applaud you. Thank you for this opportunity. And I wish each and every one of you on the Zoom tonight and those that may be watching on a replay, the best of luck in all of your endeavors. I always say, of course, like I said, I have a book about self-awareness and self-acceptance, but it's never, I think a common thing that we need to always tell ourselves is just to never to give up, that you have what it takes and that you have to complete what you started and that you cannot allow yourself to tell yourself no or anybody else to tell yourself that you can't do it, because you can.
Great. Thank you so much again. Have a great
All right,
rest of
thank
your
you,
day.
ladies and gentlemen.